Welcome back to our special week looking back on COVID-19 today. I'm Jen Chen. Thanks so much for joining us on day 2 of our 4-part series. Each day this week, we're having a candid conversation with a key figure from our city who played a pivotal role during this pandemic. From the beginning to the endemic, we're looking at all facets of this pandemic and how the city and the community were impacted. Our first responders were on the front lines every day, not only responding to daily emergencies, but also to the needs of the health crisis. Here's City Cable's Riannon Trutanich with more on COVID-19 reflections.
Thanks so much, Jen. Joining me today is Assistant Chief Kevin Millikan with the Torrance Fire Department.
Thank you so much for having me.
Thank you for being here. He and his team of first responders provided essential services throughout COVID-19, especially when it came to helping the most vulnerable. They've also been on the front lines assisting our community by responding to various emergency calls while putting themselves in danger. So do you remember the exact moment when the coronavirus was declared a global pandemic? Where were you and what happened?
I think for us here in the city, it really began on March 12th, 2020, when the city of Torrance declared the local state of emergency. And we had seen some indicators from around the country that the pandemic was coming and that we would have some sort of impact. But really that was the start of it for us, and we quickly had to adapt and make some changes to keep providing service to the community.
Wow. And since then, you were part of a team that helped launch the Torrance Cares to-go program, which helped thousands of local residents and people in our city. Can you tell me a little bit more about that?
Sure. So the Torrance Cares to-go program was a program that was a collaboration between fire department, other city departments to really help assist those in the community with meals and essential products. And really it was focused on the elderly, those that were disabled, as well as vulnerable just because of their medical history or needs to the pandemic. And so it was a way for us to help serve them as we were in that safe at home order through the county and through the state, so that we could get people what they needed during that time.
Wow, that's amazing. And general services, the fire department, transit, all came together very quickly, to bring these programs to the community. What was it like, and how seamless and quick did that have to be?
Well, it was great for our personnel to be a part of that, and we were able to deliver over 1,200 meals to the community. And I think the value of a city like Torrance and being a full-service city, being able to make those quick adjustments is one of those benefits that we have. So I know things were moving very fast, but everyone was proud to be able to be a part of that.
Wow. And the pandemic, over 2 years, during that time, you guys did a lot of different things. Tell me a little bit about the role that you played in vaccine distribution in the city, at the clinics, and bringing shots directly to residents. What was that like?
So, throughout the pandemic, we've gone through quite a few different phases. And so one of those phases was really the ability to start vaccinating individuals. So over the course of a few months, we were able to vaccinate over 4,000 people within the city. So that was including not only our own personnel in the fire department, police department, city employees, and Torrance Unified School District, but we were able to start partnering with hospitals like Little Company of Mary, Torrance Memorial Medical Center, to be able to hold clinics. We were also going into the community to those residential care facilities, ensuring that they had vaccinations that they needed. So for us as a department, we were able to obtain authority and clearance to obtain the vaccine, store it. We trained up a couple dozen of our paramedics to be able to go out into the community and provide those vaccinations.
That's amazing. And I think something that people might not necessarily think about or realize is that you guys were doing all of these programs on top of your normal responsibilities. How did the pandemic and COVID impact the day-to-day functions of the fire department?
Yeah, so you're correct. We still have to go and respond to all of the other emergencies that we have. But how we responded to emergencies and medical emergencies in particular did change. So we had to acquire and start using additional PPE or personal protective equipment, gloves, gowns, goggles, masks, so that we made sure that we were protecting ourselves as well as the community. We changed some of our deployment strategies. We brought forth additional paramedic engine companies to make sure we're providing advanced life support to the community. And then as we transitioned, further into the pandemic, we saw some of the budgetary impacts of that. So for us as a department, what that meant was starting to initiate a BLS transport or basic life support transport program through our EMS division. So these are ambulances from the fire department that are going into the community to provide that transportation. And as we're now at a year or just about a year into that program, we've seen some of those benefits. During the latest surge, when ambulance providers were having a hard time staffing units and keeping them in the field, because we had our own ambulances, we were able to shift and adjust quickly and get personnel onto those ambulances to make sure that we're still serving the community.
Wow, that is absolutely remarkable, because I know that's something that we heard a lot about in the news, not in Torrance, but in other parts of Los Angeles and California as well. So that's
Absolutely.
wonderful that Torrance could continue to help people to the full capacity. COVID hit the fire department very hard. Can you tell me a little bit about that and what it was like experiencing, seeing people that get COVID?
Yeah, so early on in the pandemic, one of our members, engineer Ricky Cradle, was one of the first in our department to contract the virus. And we quickly saw what could happen and kind of the impacts of that. And so Ricky definitely has been on a big journey, as he has definitely felt those impacts. So for us as first responders, we go into the community, we see the impact there, but it definitely hits home when we have one of our members that's been impacted so much. And really it's been trying to support him throughout his journey, and then be able to take that compassion and understanding into the community as we see members in the community as they deal with the impacts of COVID.
And normally you guys are able to have open houses and interact with the community. How did it change, living at the firehouse and all the normal events that, you guys get to do?
Yeah, so for us, our fire stations are our homes, and we're there 24/7, 365. So we had to make some adjustments with our own personnel, social distancing. We made some adjustments to our training. For a time period, initially we were in a station isolation mode where we would not have members from one station work at another, to make sure that we were protecting the workforce. And then as we look at some of those things that we enjoy doing with the community, the tours, the events, we had to scale some of that back. And we're happy now that as we were coming out of the pandemic, that we're able to start re-engaging with the community in those ways.
And during a crisis, we see leaders step up. Can you tell us, about it within your own department, how the chief stepped up and raised morale, brought everybody together, and just overall, what that was like for you?
Sure. I think for us in the fire department, really it's collaboration and partnerships. So a lot of the leadership were able to work with the city as we set up the Emergency Operations Center, and had that open and active now for quite a long time. And it's really being able to fulfill that role and collaborate with everyone else to make sure that we're serving the community and their needs. And I think, really a lot of that adaptability and adjustments really go back at all levels. We were seeing leaders in all ranks of the department, and people being able to really being able to deal with constant change and sometimes the stress that comes with that, but being able to stay mission focused and see that we're there to serve the community and what can we do to keep helping them.
Now, this might be hard to do because I know we said there were a lot of phases of the pandemic, but walk me through what a typical day was like for you at work during COVID.
I think we spoke about the constant change, and I would say a lot of it for us was what are those new mandates that are coming out? What are the different ways that we need to adjust? So a typical day would make sure that we're up to speed on what our current changes had been, and then making sure that we're fielding those calls. And how we responded just with our equipment was different. How we deployed with the kind of resources that we had was different. And then it was looking to see how do we make adjustments even moving forward, trying to project out, trying to plan ahead to see what's coming next, so that we can maintain those services.
Wow. And you guys had to pivot quite a bit during the pandemic, as we've touched upon, from the cyber incident to the pandemic starting to civil unrest to massive fires. What was it like doing that, and how did you guys do it so seamlessly?
I think the two big lessons learned for us and concepts were really the ability to adapt and partnerships. So a lot of that adaptability, really we relied on partners. So within the city, other city departments, as we all coordinated through the Emergency Operations Center, and then also with other agencies and other fire departments. So we were in constant contact with our South Bay agency partners, as well as through the greater Los Angeles area. There were regular calls with them to make sure that we're understanding best practices, seeing what's impacting other agencies so we could forecast that for ourselves, making sure that we're sharing resources if needed, and planning ahead. And those partnerships, whether it was with city departments, other agencies, or either other entities in the city with our local hospitals, local businesses, that was a huge part of the success of getting through the pandemic, as well as the ability to adapt to it.
Looking at what you guys have accomplished during the pandemic, I think that is so true, that communication is so important in such an uncertain situation, or situations, as we've seen over the past 2 years. What would you say is the biggest lesson learned during COVID?
I think it's what we just spoke about, so that adaptability in the relationships. And so as we reflect back, those two things were crucial for us. And we then start taking those lessons learned and looking forward. So, we are seeing ourselves come out of COVID, but who knows if there's another phase to the pandemic that is still to come. What is that next hurdle, or the next challenge, even outside of the pandemic, for the city? And so the ability for us to quickly adapt, build relationships ahead of time, maintain those relationships at all levels, that's really going to help us to move forward no matter what we face.
Thank you so much for sharing your stories with us today.
You're welcome. It's been our pleasure to be able to share what the fire department has been throughout the COVID pandemic.
We hope you'll join us again tomorrow as Bella Shaw sits down with Economic Development Manager Fran Fulton, who will share stories about how our business community persevered through this pandemic. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.